The following program is sponsored by the Medicine Center Pharmacies. Your mic is open.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices. Wish our friends at WHBC and our listening audience continued good health. Our guest today is Jackie Pollock, Administrative Director of Respiratory, Sleep, Neurology, and Vascular Services at Mercy Medical Center. Jackie, welcome to the show. Thanks for joining us, and we're looking forward to talking to you today.
Thank you so much.
Sleep disorders, including sleep apnea, have become a significant health issue in the United States. It is estimated that 22 million Americans suffer from sleep apnea, with 80% of the cases of moderate and severe obstructive sleep apnea being undiagnosed and untreated. Today, we're going to talk with Jackie Pollock from Mercy Medical Center, and we'll be discussing sleep apnea and sleep disorders. Our program today will also be available on our podcast. You can download Health Matters with the Medicine Center Pharmacy from the App Store of your favorite phone. And the video for this program will also be available on our YouTube channel later today.
So again, Jackie, welcome to the show. Tell us a little bit about yourself and your background.
Thanks, Paul and Brad. I'm a respiratory therapist for the last 30 years. And while I'm new at Mercy, I just started at Mercy in September, I have over 25 years experience in the sleep medicine field. I've not only developed labs, but I've managed labs, and my most recent and probably the years of my experience came from the previous Medicine Community Hospitals.
Tell us about sleep apnea. What is it?
Okay, let's talk about sleep apnea, but let's define apnea first. Apnea is a cessation or stopping of breathing. So when you talk about sleep apnea, that is then defined as the cessation or the stopping of breathing while you're sleeping. And sleep apnea is typically divided into three categories. There's obstructive sleep apnea, which we're going to talk more about today. There's central sleep apnea, and there's complex sleep apnea. So the obstructive sleep apnea is the most common. It is an apnea that occurs because the throat muscles relax while you're sleeping, and it actually occludes the airway. Central sleep apnea is an apnea that occurs because your brain doesn't tell you to take a breath. And then if you have a complex sleep apnea, it's the combination of both of those. The brain is not telling you to breathe, and you may also have that obstruction that is causing the obstructive sleep apnea. So the apnea events are what is key here. So when you stop breathing, typically your brain will tell you in your sleep, doesn't wake you totally up, but it will kind of send those messages for you to take that breath. That can happen in a severe individual hundreds of times through the night. So then as a result, your sleep ends up being fragmented and you have poor quality of sleep. So while these events are occurring, then you have concerns about the cardiac function of your body, the oxygen levels dropping. And so it actually then creates all kinds of different stressors on your entire physical system.
So what happens if we don't treat it?
If you don't treat it, it can lead to a lot of health issues. It can lead to high blood pressure, chronic heart failure, afibrillation, stroke, all kinds of cardiovascular problems. And it's also been known to be associated with type 2 diabetes and depression. So a lot of driving accidents can happen, operating heavy equipment. So if you're out there and you're not fully rested because you have sleep apnea, there's some dangers out there for you.
So most common symptoms of sleep apnea.
Most common one is snoring. I think we all know somebody who snores if we don't snore ourselves. But snoring, again, episodes of that apnea, that is typically going to be witnessed by your bed partner or someone else, because you certainly don't know that you're not breathing during the night. Gasping, so when we talk about that brain sending you a message to breathe, typically you'll wake up and you'll start gasping because you had not been breathing because of the apnea. Sometimes morning headaches are a sign of sleep apnea. Difficult staying awake during the day, that's also a sign. Difficult paying attention, and irritability. So some of these can be primarily just snoring, or you can have a combination of these different symptoms to indicate that maybe something's going on.
So how do we diagnose this?
The only real way to diagnose sleep apnea is a sleep test, and that's called a polysomnogram. And that typically is conducted in a laboratory. As you see, I'm in the bedroom right now, but you come and you spend the night with us, and then we monitor things such as your oxygen levels, your respiratory rate, your brain activity, leg movements, and then of course we monitor those apneas, because the amount of apneas that you're having per hour determines how severe your sleep apnea could be.
Common people have a whole bunch of these, or?
When you have sleep apnea, yeah, you can have a lot of those apnea periods. And that's why, again, it's very important for my technologists who are monitoring the studies to watch that kind of thing, because if somebody gets into trouble during the night because they're having so many of those apnea periods, then they flip it in where we start doing the treatment, or the Cpap, which we'll talk a little later on about here, where they actually start to treat that symptom, because the severity is very present, and we wouldn't want to send somebody home that has that kind of severity.
Sure. Interesting.
Can you explain the difference between in-home sleep testing and in the lab sleep testing?
Sure. The in lab is again, you come to the lab, you spend the night with us, and we're able to monitor so many different parameters, as we talked about, the oxygen levels, the leg movements. You have the wires hooked up to your head, so we're actually measuring sleep as well. A home study, that is a portable study, and not that it's not a good study, it's just not as in depth as a in-lab study, because it can only monitor like 3 or 4 channels. So you're not really you're not monitoring sleep activity as much as you're monitoring breathing activity, because you can monitor the oxygen levels, you can monitor breathing efforts. But there are, both studies of those are available. Mercy does offer both of them, and the home studies are becoming more popular. But again, like I say, there are some drawbacks to those studies as well.
Any benefits to sleep studies at home versus in your lab?
The first and foremost, most of the home studies are going to be dictated by your insurance company, because insurance companies usually will tell you whether or not you can have in-lab, or they may actually require you to have a home study. When you look at a home study, you have patients who have physical limitations, perhaps can't get out and come into a laboratory, or they have the fear of coming in here and sleeping in a strange place. They don't think they can do it with all the wires on. So in that case, a home study versus no study at all is certainly going to be beneficial. Home studies are typically for that classic individual who's got sleep apnea, the 42-year-old male who's obese, who has a size 19 neck, and you're pretty confident that after running a home study, you're going to have a positive study. The Academy also sets guidelines for us that if you're not 18 years old or above, you cannot have a home study. So 17 and under, no home studies are permitted. If you have other illnesses, if you have lung disease, if you have heart disease, any kind of cognitive issues or neurological diseases, those are not candidates for home studies. So it's very important when you try to determine a home study versus an in-lab study that, again, you take that full history to see, is that patient going to be safe at home to be able to do that study, or should they be an in-lab study? But again, like I say, a lot of times insurances will dictate exactly what study you're going to have.
Okay, so where does Mercy perform sleep lab testing?
Mercy actually has 2 locations. We have a 6-bed laboratory inside the hospital in our medical office buildings, and then we have a 4-bed laboratory out at the Jackson Stat Care. We're actually within the building of the Stat Care. So it is very comfortable settings in both of the locations. The rooms are set up like hotel rooms. They have private bathrooms and showers. They're handicap accessible. We have intercoms in the room, so the technologist and the staff are able to communicate all through the night as needed. And again, like I say, televisions are here. Again, it's a very, very comfortable setting. If you can't be sleeping in your bed at home, this I would say would be the next best thing if you have to have the diagnostic testing done.
All right, so what's a garden variety experience for a patient that comes to one of your sleep labs at Mercy? What I'm thinking, okay, there's going to be people watching me all night, or what? How do you conduct that test and put them at ease so that you can get good data?
Well, you're right. There are a lot of eyes watching you while you sleep, which again is an uncomfortable feeling, because we do have cameras that do monitor. And the reason for those cameras is so that we can keep an eye on the patients, as well as when we talked about earlier, the different kinds of sleep disorders aren't just apnea, but we want to see if there's leg movements happening, if they're kicking. So there are cameras set up. So again, first, a sleep study, home study, or in-lab study has to be ordered by a physician. You cannot just, do an over-the-counter home study or request a study without an order. So we tell the patients to come in with very loose-fit clothing because you're going to have wires hooked up to you, and we want them to be able to be not confined in bed. So we walk them through it as my technologists are setting them up. They're talking through the whole process. Again, we're putting leads on their head. We're putting leads on their chest. Again, getting all of the wires in place to be able to monitor the patient. We've already mentioned about the intercom, so patients can feel safe that they can reach out or contact our staff anytime through the night. We have a medical director who's in charge of our laboratory. He's available through the night if there's any issues or problems that arise. And then once that study's completed, let me back up. We have lights out about 10 o'clock. Patients have to go to bed about 10 o'clock so that we can get a good, thorough study. And once that study's completed, then we do compile the entire night. So every epic of sleep is compiled by a scorer, and then it's put into a final report where it's then interpreted by one of our sleep physicians, and then the primary care physician will get the results at that point. Some primary care physicians do refer them to our sleep specialists because they want us to continue the care. Some are very comfortable with caring for the patient with obstructive sleep apnea.
What if they don't sleep? I mean,
that's a problem. That is a problem.
I can imagine some of those people coming into your program, and I was like, all these people watching me, and this is making me crazy,
Yeah, for you and I who may not have sleep apnea, that is a fear, but typically a person who has sleep apnea, and this is what we tell the patients, you're going to sleep just about anywhere because you're deprived of sleep. And so once you're able to relax, you can absolutely. We rarely have to send a patient home because they don't sleep. We do have some patients who require medications for sleep, and they may have been prescribed that by their physician. And we do ask them not to take it the night of the testing because we want a test that's going to be clean without drug effect. But we would allow them to take that medication if, in fact, it really was the last resort that they could not sleep and we couldn't get a good study.
Okay, our first break's here. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy. The mics are clear. Pharmacist.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Jackie Pollock, Administrative Director, Respiratory, Sleep, Neurology, and Vascular Services at Mercy Medical Center. I have a question posted on our live Facebook. So, did you finish, Brad?
I think you finished up on what a patient could expect when they come to the clinic. Is there anything else you wanted to add on that before we move on?
No, I think we pretty much summarized it.
Okay.
Very comfortable setting. Let me just assure you of that.
So I'm not sure whether we got an answer to this question or not, but what are the treatment options? I mean, we talked about being at home and going into, actually into one-year facilities. Is there anything else to add, or?
Oh yeah, the treatment options, the first and foremost popular treatment option is a positive airway machine that a patient would use at home. I'll talk a little bit more about that. There are oral appliances out there. There are surgery options out there. Sometimes it's just simple positioning where you don't have a patient sleep on their back, they're sleeping on their side instead, or even weight loss sometimes can help with sleep apnea. But the obstructive sleep apnea that we typically treat, we treat with a Cpap machine or that positive airway pressure. And again, the purpose of this is to splint the airway, to force that pressure in so that those muscles that are weak and collapsing the airway stay open while you're sleeping. That is it's a machine that, again, blows positive pressure. It does require a second night testing. Most people don't understand that sleep testing is done in 2 nights. You come in the first night for that diagnostic test where we can actually diagnose you with the obstructive sleep apnea. Then we bring you back in for a second night study where we actually put the CPAP unit on you. You have the mask that you're breathing through, and then we monitor you through the night and we adjust pressures so we can see that those apnea events stop happening. So we get that little sweet spot or that pressure that does best for you. And then that's when, again, the study is read by the interpreting physician. Then they would recommend that CPAP be used at that amount of pressure, and then patients can have the equipment in the home. Again, CPAP testing, just to clarify, cannot be done with a home study. So you can have the diagnostic portion done as a home study. but you would have to come into the laboratory for that second night study. Again, all of these different options there's tons of things coming out all the time on how can you treat sleep apnea. I know up in the Cleveland areas, you can have like an implant put in your diaphragm is, breathing, or the back of your throat stays open and it forces you to breathe. So there's so many different options out there, but our basic, still the best remedy that we find is that the positive airway pressure, those CPAP units are what really helps patients feel better, gets a good night's sleep and a good quality of sleep.
The Cpap machine is not a cure, right?
It's not a cure, absolutely not. Again, there's not a whole lot you can do unless you get into the surgical options, and some of those, you can certainly try the surgery options, but again, the Cpap is the best non-invasive way to go.
So if your doctor orders a Cpap machine, what can I expect?
You can expect a visit to a durable medical company. They are the ones who set up the Cpap units. They would set up an appointment with you. They try to find a mask that's comfortable for you. There's so many variety of masks out there. And wearing Cpap, it's an art and it's a process. It's not going to be something that you're going to take home, wear the first night, and then be convinced this is going to help you throughout. It's because you have that pressure blowing in at you. It's kind of a trial type of thing. So we frequently recommend trials. If you can go 2 hours, then take it off. You can go another 2 hours, and each night build up to the point where you can have a complete night's sleep. Durable Medical Company works very closely with the physician, with the sleep lab, the insurance companies, and the sleep specialists to monitor those patients at home, because again, remotely they can monitor the compliance of use. They can see whether or not the mask is fitting them properly, and they can again give those reports to us so that we can see whether or not the pressures are adequate for the patient, if they're able to wear it comfortably, and then again, what are any issues, or where do we need to tweak where they're at home. It's a process. So I recommend don't get frustrated, because again, it does take time to get used to, and once you're used to it, you'll never go to bed without it.
Well, when I've looked at those devices, and, gosh, how could I sleep with this all over my face and restricting my ability to roll over and whatever.
Yeah, it's a whole new way of sleeping, but the people who use them and really benefit from them, you'll never have them go to bed ever without their Cpap unit.
Interesting. So can a primary physician order sleep testing?
Absolutely. It is very much able to be done by a physician. Any physician can order studies. What we would require in the laboratory is that we have to have a face-to-face office visit where they're actually talking about a sleep history, and they're giving us reasons why the sleep study is necessary. And again, a lot of primary care physicians are very comfortable ordering the study, getting the results, ordering that second night study, and managing people with OSA at home. Others just want to kind of send them to a sleep specialist and let them handle that. So it can be done either way.
What about, you've kind of alluded to it, and I know it's kind of a hard question to answer given the diversity, but what about in general insurance coverage and expectations for a patient who really has a need for a service like this?
Most insurance companies will cover sleep studies. Again, they will dictate whether it's done in lab or at home. They will dictate whether or not a one study or a two study can be done. If a patient's severe, just kind of let me throw this one in. If the patient's very severe, we may do what we call a split night, where they'll come in for that diagnostic portion. But if they really show severe issues and the oxygen levels are dropping and maybe they're having some arrhythmias, we can, through our protocols, put them on a Cpap machine at that point if we have enough of the night left to try to titrate them. Some insurance companies won't pay for that. So again, it's just kind of knowing what you're able to do for the patient. But yeah, insurances cover most of the time. I have very little information that the insurances wouldn't cover it if there's a need and enough documentation to support the need.
And I'd like to assume there's some benefits too on the equipment side and the supply side, but that's probably a topic that's maybe a little more diversified for that particular person's insurance. So.
Absolutely, absolutely. And again, insurance does dictate a lot of that.
Yeah. All right, well, I think we're about time for the news, and we'll pick up more discussion with you on the other side.
Okay.
Okay, as Brad said, listen to Health Matters.
You're listening to Health Matters with the announcer. listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
As JD said, you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing sleep apnea and other sleep disorders. We've got a lot more to cover this morning, so let's get back to the show. One more question, Brad, right?
Yeah, let's see here. So we were talking before the break about insurance coverage and some things of that nature. And now I think we want to talk about accreditations, because accreditations are really important as far as not only the quality of the program you have at Mercy, but also the standards you have to uphold for the American Academy of Sleep Medicine. Can you talk about how that affects your facility and your operation and the value it brings to the patient?
Sure. We actually just achieved our renewal of accreditation. It's a 5-year accreditation, and what it does is, since probably about the late 70s, the American Academy of Sleep, they've created the accreditation standards that are the gold standards for sleep laboratories. And so when you're looking for a facility, or a physician wants to send a patient to a facility, you want to be able to send them to a high quality facility that does not only high quality work, they are patient-centered, and that they're using those standards that the Academy has set forth to make sure that, again, the quality of your lab is top-notch. Even some insurance companies will dictate that you have to go to a lab that is an accredited lab as well. It's certainly a voluntary program, but we've done it for years. And I think it just tells our community that we want to give them the highest quality of care that we can. And we follow all of the recommendations and regulations that the Academy sets forth.
We've been talking about sleep apnea today. What other disorders impact listeners' sleep?
There are a lot of sleep disorders, probably too many and a whole different show again, but primary ones that we see besides the obstructive sleep apnea is insomnia. And insomnia is just a sleep disorder where a patient has difficulty falling asleep and staying asleep. So that's a whole different track than the sleep apnea side of it. Restless leg syndrome is another one, and that is where patients have the intense and often irresistible urge to just move their legs, and sometimes they just have to get up and walk all the time because their legs are driving them crazy. So imagine trying to sleep and having that restless leg. That's where, again, when we're monitoring a patient, when we have the videos on them, we actually have leg leads monitoring them as well, because that is something that can be diagnosed through a sleep study as well. And then a common one is the narcolepsy testing. Now, narcolepsy is a neurological disorder. And again, people end up not only experiencing excessive daytime sleepiness, but they'll end up with uncontrollable intermittent episodes where they just fall asleep. You'll find, and have probably heard stories where a person may fall asleep at a traffic light, or they may fall asleep mid-sentence while they're talking with you. So those are all some of the different issues that can happen within sleep. And again, those when they get that complicated, probably would need to be directed towards a sleep specialist.
Does Mercy have sleep specialists to evaluate these different types of disorders?
Yes, we absolutely do. Actually, we just got a new one that joined us in February, Dr. Amir. And Dr. Amir practices here out of the Jackson Clinic. And again, he's able to treat and help the primary care physicians support those patients that have those other types of sleep disorders.
So are you saying that the restless leg syndrome is related to sleep apnea?
It can be, or it can be a totally separate diagnosis. And then sometimes that's a medication that takes care of that, as opposed to the Cpap units or that kind of thing. So that's when they get more complicated, and you got to rule out the sleep apnea first, and then see if there's other underlying things going on.
Sure. So we're open now. Okay, you're open now. So are you accepting new patients now?
Absolutely, absolutely. Patients can call and request a referral directly, or they can go through their primary care physician and have them send a referral over for us, but absolutely.
So what's meant by healthy sleep, and why is it important?
Well, again, sleep is very important, and in our sleep community, it's one of the 3 pillars of healthy lifestyle. We talk about nutrition and exercise, and sleep is right up there with them. It is somewhat unbelievable how much quality and healthy sleep can help you. Healthy sleep is good for your physical health. You get peak performance and productivity. It helps you fight off infection, maintains healthy weight, and you can actually avoid chronic diseases. Without healthy sleep, we've talked about it before, we find that there is a connection between heart disease and type 2 diabetes. Healthy sleep is good for your mental. If you're not getting a good quality night's sleep, you have problems balancing your moods and your emotions. You're probably going to struggle with some anxiety and depression. Quality, healthy sleep improves your focus and your memory. You think more clearly, you react better. Again, like say, you tend to get fogged and forgetful and make more mistakes when you don't have a healthy sleep. And on the public safety part of it, if you're driving while you're sleepy, or you're working equipment at work while you're sleepy, that can cause not only harm to you, but perhaps individuals out on the road or at your workplace as well. So healthy sleep is very, very important. It's not just about the amount of sleep, it's about the quality of sleep as well.
I've heard people over the years tell me that they've consumed all kinds of food and liquor and alcohol and stuff right before they go to bed. Did you advise the patients in these programs as to what to consume and not to consume, or?
Yeah, that's actually something we could discuss moving forward. Is part of the sleep hygiene, and yeah, it is not recommended that you have a big meal before you go to bed, or that you have alcohol prior to going to bed. Again, everything in moderation, but when you're thinking of trying to get a good night's sleep, a heavy meal with rich foods or fatty fried foods are not what is going to be recommended. Besides the fact that they sit difficult in your stomach, sometimes they cause you indigestion, and that itself can cause you a hard night's sleep.
No pizza.
No pizza.
No alcohol at all.
In moderation. Again, alcohol is proven, and we all know that it makes you go to bed and makes you go to sleep faster. But then on the second part of your night of trying to sleep, then as your body's trying to process that alcohol, then that's again where it causes you some issues and problems, and actually you end up being more sleepless than you did on the first night's sleep.
Sure. So we talked about sleep hygiene, and interesting. How much sleep do we need? I know it varies from young children to older adults, but what's a garden variety recommendation for overall good practices to keep in mind?
Most adults require 7 hours of sleep. Some require more than that. It's important to, again, have a regular bedtime and keep that pattern going. But 7 hours, children and teenagers can require 12 to 15 hours of sleep. So when your teenagers are still in bed, really their body needs to have some of that sleep. So
should cut them some slack.
Yeah, cut them a little bit of slack.
All right. Personally, I found lately, I've been trying to be more consistent, especially with the stress of COVID and everything going on. And I find that even though I probably stay up later than I should, if I try to go to bed at the same time of night and get up at the same time in the morning, I seem to be a lot more refreshed than trying to do those 10-hour makeups on the weekend that you think you're getting more sleep made up, but that doesn't seem to work that way. But
No, you can't make up for that lost sleep.
So,
any other tips to improve sleep hygiene before we move on?
Yeah, sure. People think, again, you just reverted to that, that naps help you throughout the day. And you really probably should limit napping, because again, if you're napping through the day, then you're not going to be able to get that good quality sleep at night. So they do suggest limiting it to maybe a 20 or 30-minute nap. Again, contrary to belief, napping does not make up for that inadequate sleep you had the night before, but it does, in some instances, will help your mood, improve your alertness and performance. Again, avoid stimulants. You shouldn't be drinking caffeine or smoking your cigarettes close to bedtime. We talked about the alcohol, where again, it does put you to sleep much faster, but that second half of your night, your body's processing that alcohol, and it starts to, again, interfere with that quality of your sleep. Exercise is always recommended. Again, even as little as 10 minutes of walking or cycling, again, it does improve good quality sleep. So we certainly do recommend that people, find time to have some exercise. Now, strenuous exercising prior to going to bed isn't recommended. We're talking about earlier in the evening before you would be going to bed. We kind of talked about the heavy foods. You don't want all of those foods laying in your belly, plus you don't want to end up with a bout of indigestion, which is all naturally going to impact your sleep. Exposure to daylight and nighttime. Again, people who are frequently not outside they need to have that normal sunlight during the day. They need to have darkness at night. It helps our body know that there's a healthy sleep-wake cycle. So, when it's daytime, we should be out there absorbing some of that sun and knowing the daytime. And then at night, then, your body knows that at that point it's time to decompress and relax and go to sleep. Routine bedtimes. We've already talked about that. You should have your nightly rituals. Again, that should include warm baths or reading a book, very light exercise perhaps. Really, you should avoid any kind of, upsetting conversations or activities that are going to be pretty strenuous before you go to sleep. And then again, your sleep environment is important. You should make sure that you have a comfortable mattress, comfortable pillow, and typically they say the bedroom should be cooler. They recommend 60 to 67 degrees for optimal sleep. And you're not going to like hearing this, most of the people out there, but your cell phone should be off, TV should be off, lights should be off. Those again can interfere with your sleep. So if you are looking for aids to help you out, you can consider the blackout curtains to make sure your room is as dark as possible. Some people wear the eye shades at night, earplugs. There are the white noise machines. Some people sleep with fans or run humidifiers. Anything that again kind of creates that atmosphere of being relaxed in your bed. All of that would help.
The one thing I heard lately was total darkness in your bedroom.
That's your preference. Again,
You get up in the morning and go to the bathroom and you fall over the bed or
yeah,
something.
well, you gotta be safe too, Paul. So yeah, but again, it should be as small or dim as light as possible. But yeah, a night light in the bedroom is certainly not taboo, because again, you got to be safe about what you're doing as well. But we get into that generation, and our kids are the same way, where they're the cell phones on the night table or right in the bed with them, and every time somebody's texting or those lights are going off and on all night long. Again, that's at a constant interruption of sleep.
So, I don't know, I think you covered it all. The room, the bedroom, and all that stuff. Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy, and thanks for joining us today. We are now in the last segment of the show.
All right. Well, you had a story that you might want to share about a patient's experience in a sleep lab. So how about we talk about that before we give our takeaway themes for the day?
Sure. As I had introduced myself, I've set up sleep labs in the past, so I can tell you that I was trying to set up a sleep laboratory, and so we were evaluating the equipment that we needed to use to start our testing, and so I needed a guinea pig. I needed a patient to come in and sleep for us. So I had a brother-in-law who could snore the roof off of a house, and so I asked him if he would mind coming in and sleeping with us during the night. And so the rep was here, and we were setting him up, and he went to bed. And again, as I told you before, we're monitoring his oxygen levels, his heart rates, and this guy is just the biggest train wreck I've ever seen in my entire life. And I'm thinking, oh my God, my sister-in-law's going to kill me. He's going to die on the spot with us. So as we were testing him, I ended up having to call his primary care physician and ask him if we could flip him to that split night that I referred to earlier, where we could actually treat his sleep apnea, because he had probably one of the most severe sleep apneas that we had ever seen. And he came in just to appease me and to get the testing done. So the doctor's like, well, so what are you doing with him, and why is he in your lab? So I had to explain the story to him, but he was my classic. And again, one of those individuals that as soon as you put a CPAP unit on him, he was going to be compliant from that day forward, because he knew how much better he felt when he used it. And the sad thing is, he was a shift worker, so that certainly played a part in him. He was a Timken employee who did the shift work, and my sister-in-law would get so frustrated, and she felt so bad after all of this was done, because she said he'd come home and he'd be like a bump on the log, and he didn't want to go out and do anything. And she said, I was so frustrated with him, and she never realized that he had such a severe problem, because I think people think snoring is just normal, and it really isn't. So there's something going on if you're snoring, and it does need some evaluation done. But that was my classic first lab setup. It was pretty interesting.
Making impact where it matters most.
Be a good patient.
I'm sorry?
he a good
He's a
patient?
very good patient. Like I say, he is as compliant as can be, and he wears his CPAP every night faithfully.
You know,
Whole different person.
Timken, I don't know what Timken does now, but they used to rotate those folks. Like 1 week you'd work
Yeah.
day, next week you'd work afternoon, next week
Yep.
you'd work midnight. Are they
Yep.
still doing that?
I think they do. He's retired now, but yeah, I think they still do a lot of that rotating shift, and that's actually a disease. It's a disorder I didn't get into here, but it's actually called shift worker syndrome, and people who have to acclimate themselves. It's different if you're going to acclimate to one shift, such as a midnight shift or an afternoon shift, but when you have to rotate those shifts, it does interfere with your normal sleep cycles, and it can become an issue. Absolutely.
I never could quite figure that out as to why they did it that
Yeah.
way. For years they did it that way, and they
Yeah.
at one
Not-
time, they had thousands of people working down
Yeah, not quite sure what the philosophy behind that is, but in the sleep community, we certainly don't recommend it.
there. Right. Very interesting. So, how about some additional information to our listeners as to how we get into your program, and you know, I know this is a really, probably a really difficult thing for many people to decide, I'm going to do this.
Exactly.
And then I'm going to wear this thing all the time when I sleep.
Yeah.
So,
Yep, absolutely. We have Mercy Medical Center, you can actually get on the website. So if you did the www.cantonmercy.org, and you can /sleep, and you can get on there, and we have a whole array of information, links to get you more information regarding sleep and sleep apnea. If you wanted to contact the lab, you can contact the lab directly, and that phone number is 330-489-1456. If you'd like to contact the Jackson Clinic, perhaps get an appointment with our sleep specialist, that phone number is 330-830-6113. Ashley and Tiffany work at our Jackson Clinic. They'd be more than happy to assist patients there.
so how do we maintain this thing? We have to clean it or?
Oh yeah. You see the commercials out there with the So Clean. So you can buy those types of units to actually clean the machine for you. But it's very important to keep clean, because again, it's breeding germs, and it's, you know, you want to make sure that you have, and they do recommend you clean it daily. There's filters that need to be cleaned. And then again, back to that insurance conversation, insurance does allow changes of masks and tubing on certain schedules, and your durable medical companies are there to comply with that. So again, you should be getting the new masks and the tubing on that regular basis, so that your machine can be kept clean and it keeps you healthy as well.
So we plug this thing into what do we do? So Clean? Is that what you're saying?
Yeah, the So Clean is it's a cleaning device that you can clean the mask, the machine, the tubing, the water reservoir. If you're using humidity, it cleans it all at once. That's out there, and there's other devices as well that can clean the units, that you don't have to go to the sink and do it with soap and water. But some people have it down. Some people use the soap and water every day, and they clean it, hang it dry, and they're good to go.
What's it look like? Okay, I've seen them, but I can't remember what they look like.
The Cpap machine, it's a small little box that just really blows pressure. It's I don't want to call it a compressor because it does have set pressures in it, but it's a very small device, and they become smaller and smaller. And you and I talked during break, they actually have portable units now that if you are traveling, or if you have a vacation, you know, want to go out on your boat, or go away camping or whatever, you can actually run these units, these portable units. So they're making new and new. It used to be they were probably as big as a bread box when they first started out, but these units are very compact, very easy to travel with. Again, airlines realize that people have sleep apnea, so when you're going through any kind of security, they know Cpap machines are acceptable, and they're able to go through it. But yeah, they're very more mobile, because again, we want people to use them.
One more time for our listeners. It conditions your breathing system. Tell me
It splints that airway open. So the Cpap unit forces a pressure in your airway that keeps the back of your throat and your soft palate open, so that again, it's not collapsing, and it allows you to breathe without stopping breathing, without having those apnea events.
There's no oxygen attached.
No oxygen. Some patients do require oxygen during testing, but that's something that we monitor as well. But typically, the classic OSA patient doesn't typically need oxygen. They just need that Cpap pressure.
Okay, so it's simple to say that if you're a Cpap user, you're kind of on your own. right? I mean, the device helps your body, your breathing
Absolutely.
work, I guess. What's the longest amount of, how many, how do I just explain this? What's the largest amount of, shall we call it like a seizure of shutting down your breathing?
Oh, as far as apnea periods, they can go as long as a minute. And again, that's where we have to worry about what's going on. And that's where you see that some people do die suddenly in their sleep, and it could be attributed to sleep apnea because they've had those long events of apnea, and their brain's telling them to wake up, and maybe perhaps they're not. So it does happen. We certainly, that's how we classify how severe your sleep apnea is how many did you have and for what period of time was that apnea event.
Well, Jackie, thank you very much for appearing with us today. We learned a lot. Okay.
Sure.
And Jackie Pollock, Administrative Director, Respiratory, Sleep, Neurology, and Vascular Services with Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Russ Glass, and of course, our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here next week on this topic. Be safe.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your